Hello, I'm Jonathan Nelson with the Texas Academy of Family Physicians, and this is your Capitol Report. The 82nd Texas Legislature is more than halfway over, and lawmakers are struggling to craft a budget that will spend somewhere between $15 billion and $25 billion less over the next 2 years than in the current biennium. Early this month, the Texas House of Representatives wrapped up their work on the budget. For more on that, here's TAFP's Kate Alfano.
After 3 days of debate, the Texas House passed House Bill 1 on April 3rd. The $165.4 billion budget for 2012-2013 spends $23 billion less than the current budget. It cuts essentially every area of state government, especially the two largest, education and health and human services. The House budget reduces physician fees in Medicaid and CHIP by 10%. It cuts total state spending on graduate medical education by almost 44%. And it eliminates funding for the Physician Education Loan Repayment Program. Chair of the House Human Services Committee, Representative Richard Pena-Raymond of Laredo, says that these cuts will strain local communities.
The cuts that are being proposed here in Austin right now absolutely and directly affects communities all over Texas. Those cuts aren't confined here to the Capitol building. The fact is that the proposals that were passed in the House, the budget that was passed in the House, and those that are being contemplated in the Senate, those are going to go direct. Those cuts will be felt directly in every part of Texas and communities all over the state. So what we do here will affect every one of the districts that we represent.
TAFP past President Dr. Doug Curran of Athens says these cuts could be devastating to rural health care.
Well, the current House budget, the way it's come out, would just have a terrible effect on rural communities because we have to see all the patients that are there. They're not going anywhere else, and we can just see a limited number in our office and keep our office open. And so it's going to force those patients to go to the emergency room, which is a much more expensive environment, and it's just going to cost the state more money at the end of the day if the budget stands as it is.
The Senate continues to work on its own version of the budget, where senators are actively searching for billions of dollars in non-tax revenue. Their version of the budget will likely spend about $10 billion more than the House version. Once passed, both bills will go to conference committee. For TAFP News, I'm Kate Alfano.
The House budget cuts spending on graduate medical education by $53 million. $26 million of that comes from the elimination of a set of programs managed by the Texas Higher Education Coordinating Board that support primary care residency training. TAFP Vice President Claire Hawkins is the program director for the San Jacinto Methodist Family Medicine Residency Program in Baytown. He says his program depends on that funding to train the next generation of family doctors.
For our program, we're the average size of Texas residency programs, and it would affect us about $350,000, which is a significant chunk of our operating margin. And since we operate on a pretty much a break-even or shoestring, that would make us have to make some cuts, either in terms of not bringing in certain residents and having lower numbers graduate, or having less faculty to be able to teach those residents. So it would make a substantial decline in the product that we would produce and the quality.
More than 680 residents are in training in the state's 28 family medicine residency programs. In the clinics where they train, 6 of every 10 patients they see are either on Medicaid or Medicare, or they're uninsured. TAFP has released a new issue brief describing the importance of these training programs and asking the legislature to restore their funding. You can download the issue brief from the Advocacy Resources page of TAFP's website. The House Committee on Public Health unanimously approved a bill that many physician educators believe will help keep Texas-trained doctors in the state. House Bill 1380 by Representative Vicki Truitt of Keller would allow international medical graduates to receive a medical license after 2 years of residency training instead of 3. Its companion bill in the Senate is SB 1022 by Senator Jose Rodriguez of El Paso. The current stipulation means IMGs have to wait, sometimes several months, before they can begin working once they've completed their training. To avoid this delay, they can seek licensure in states that don't have that stipulation, but as TAFP Treasurer Troy Fessinger says, once they have that license in hand, they have an incentive to leave the state.
We in Texas spend large amounts of state dollars training them, and then we lose a physician to a neighboring state. And you can understand it from a resident's perspective. They're trying to earn money to support a family. They're trying to pay off over $100,000 in educational debt. There's a lot of pressure to start work as soon as possible. If that opportunity is available in another state, they have an obvious incentive to take it, and it's hard to blame them for making that choice.
The bill now goes to the House Calendars Committee to be scheduled for a hearing on the House floor. With a multitude of contentious issues still to come, including legislative redistricting, an effort to repeal the ban on the corporate practice of medicine, and a handful of bills that would grant nurse practitioners independent practice, the next several weeks are sure to be exciting. We'll be here working to keep you informed. Watch for TAFP's quick info in your email, and join in the discussion on TAFP's new blog, txfamilydocs.org. And don't forget to find us on Facebook and follow us on Twitter. For more in-depth coverage of these and other issues important to the family physicians of Texas, check out the news update block at TAFP's homepage, tafp.org. Thank you for watching TAFP's Capitol Report. I'm Jonathan Nelson. We'll see you next time.